So this is a big topic, but we're going to cover it in the shortest amount of time as possible. Do you use labs or not? I'm so conflicted now. I need to know what's going on in my body because I don't feel well, but I've also heard labs don't matter. Help. So when it comes to laboratory testing, they can be useful. They're not the end-all be-all for everything that you need in order to heal your body and change your life. They are a reflection of a portion of what's going on within your biology, your physiology, your biochemistry, a tiny, tiny portion of the entirety of what's going on in your body. So the more basic labs and the more reliable labs can be useful in some ways if you're using that information appropriately. If you are just going to be treating the laboratory values and manipulating your body to produce laboratory values that fall within a normal reference range instead of diagnosing the life that produced those in that body, then you're going to miss the point. So the best way to go about it is to, if you are going to be someone who uses laboratory testing, which is most people, because for the most part you're not going to get into any healthcare facility or access to any healthcare provider without laboratory testing. So it's got to be you in the driver's seat that knows how to use them appropriately. So it's not going to be give me every substance to manipulate my physiology and biochemistry back into a normal reference range and treat this piece of paper. It's going to be with the understanding that this is a snapshot in time of a very dynamic process that could change with the next breath, within the next hour, within the next 5 minutes. If I get excited, if I get sad, if I lost somebody, if something amazing happened, my blood would change and reflect all of those changes, because even my hormones are a reflection of the life that I'm living and how I'm experiencing it, not just what's causing my experience, like we're often told. So when you get laboratory testing, use it as information, but don't use it as what you're treating. Use it as a reflection of a small piece of what's going on in your brilliant body, and don't even diagnose your body. Don't stop there. Diagnose the life that's creating those effects in the body, because the cause is in the life. You need to change the life to change the labs. You don't change the labs to change the life. And so when you change the life changes the body. And when you change the body changes those labs. And no matter what, your labs are a demonstration of your body doing things perfectly. That is a reflection of how your body is surviving and compensating in the life that you're living and how you're experiencing that life in order to keep you alive. So we've got to kind of flip it upside down, like all things in medicine. See it, use it appropriately. It's not that we stay away from these tools that modern medicine has available. We just use them differently. And in my practice, we use them as the beginning and the end point for that final conclusion, even intellectually, to where you can go and take them and be like, see, I told you. It's not just wishful thinking. It's not looking away and hoping that it's not there. It's a very practical way of going about healing. And but it puts you back in the driver's seat and not the physician, because if manipulating your body back into submission is the therapeutic approach, the physician is the most important part of that equation. If changing the life is what's going to change the labs, it's back on you. And you're no longer wanting to gather all of the manipulation-based therapeutics from pharmaceuticals, nutraceuticals, your herbs and supplements, all of those different things to manipulate yourself out of the effects of your life. You start looking to your life and you start making changes in your life so that that's demonstrated in your tissues, so that's demonstrated in your physiology and biochemistry, and that has to change the labs. So it's just a different way to look at it and go about your therapeutic approach, if you will. So it's not that we don't use these things in this medicine, it's that we use them and we put them in their proper place, and no matter what, our eyes are on you, our eyes are on your life. We diagnose your life, and that we put more priority on that than diagnosing even your body, and definitely more than we put on a snapshot in time that is laboratory testing.